Hello dear friends, how are you doing today? I hope you are doing well. Today we are going to talk about lentigo. Definition: a lentigo plural lentiginous is a brown macule caused by an increased number of melanocytes. Two types are recognized: lentigo simplex lesions arise in childhood and are few in number, whereas actinic or solar lentiginous arise in middle age and are numerous in sun-exposed skin. Actinic lentigo, small brown macules in sun-exposed skin of a middle-aged person. Epidermis, we can see increased basal layer pigmentation resulting from an increase in melanocytes and melanin. Retial ridges are elongated. Lentigo simplex occurs in childhood and is idiopathic. Actinic lentigo occurs in adults and is sun-induced. Incidence: lentigo simplex is unknown. Actinic lentiginous are found on more than 90% of white patients after the age of 70 years, but seldom cause a patient to seek medical advice. History: lentigo simplex may be congenital or may arise in childhood. It has no relation to sun exposure. Conversely, actinic lentigo is acquired in middle age, does not fade, and occurs in sun-exposed skin. Patients often call actinic lentigo liver spots. Physical examination: lentigo is a uniform tan brown or dark brown macule. Lentigo simplex is sharply marginated and occurs anywhere on the body and mucosae. These lesions are usually few in number. Actinic or solar lentigo is a tan or brown macule ranging in size from several millimeters to several centimeters with distinct borders. The lesion occurs in sun-exposed areas of the body, particularly on the dorsum of the hands, neck, head, shoulders, upper trunk, and lower legs. Differential diagnosis: in childhood, the differential diagnosis of lentigo includes junctional nevus and freckle. In adults, seborrheic keratosis and malignant melanoma in situ or lentigo maligna are included in the differential diagnosis. The most important of these is a melanoma, which appears in irregularly colored varying shades of brown and black, irregularly bordered macule, typically on sun-exposed regions of the body. The conclusion of differential diagnosis of lentigo include junctional nevus, freckles, seborrheic keratosis, and malignant melanoma in situ. Laboratory and biopsy. Biopsy is seldom indicated unless there is concern for a malignant melanoma. If a biopsy is performed, the histologic picture is characterized by an increased number of melanocytes within the epidermis as well as increased pigmentation within their keratinocytes. The retial ridges may be normal or elongated. Therapy. No therapeutic intervention is required except for cosmetic purposes. For multiple actinic lentiginous, tretinoin cream 0.1% or retin A applied nightly is effective in lightening these photoaging spots. Irritation, however, is common, thus requiring less frequent application every other night or every third night, or use of less concentrated creams like 0.025% or 0.05%. Preparations containing hydroquinone are generally ineffective. A combination product 2% mequinol plus 0.01% tretinoin solution or solage applied twice daily lightens these spots. Middle freezing with liquid nitrogen, mild freezing with liquid nitrogen, or laser destruction of these pigmented lesions is effective. Sunscreens with a sun protective factor or SPF of 30 or greater should be used to prevent the development of more actinic lentiginous. The conclusion of therapy for actinic lentigo include prevention with sun protection, and initial therapy include cryotherapy, and alternative therapy include laser tretinoin cream 0.1% daily or less frequently, and mequinol 2% plus tretinoin 0.01% solution or solage twice daily. Course and complications. Lentigo has no malignant potential. Noonan syndrome with multiple lentiginous are rare, but distinctive syndrome is characterized by hundreds of lentiginous on the trunk, head, and extremities, including the palms and soles. It is dominantly inherited and formally called Leopard syndrome, which is the mnemonic of lentiginous electrocardiographic abnormalities, ocular hypertelorism, pulmonary stenosis, abnormal genitalia, retarded growth and development, and deafness. Pest-Jiggers syndrome is a dominantly inherited trait that is distinctive because of numerous lentigines occurring around the mouth and eyes, as well as on the lips and mucosae, hands and feet in association with gastrointestinal polyps. Intussusception, hemorrhage, and malignancy are complications of these polyps. Clinical case: a 62-year-old woman presents with several dark spots on the back of her hands and face. She reports that these spots have slowly increased in number over the past 10 years. They do not itch, bleed, or change in size. She spends a lot of time gardening and has a long history of sun exposure. On examination, you see multiple well-demarcated, uniformly brown macules measuring 5 to 10 mm on sun-exposed areas. The lesions are flat, non-scaly, and do not fade during winter. Which of the following is the most likely diagnosis? A. Freckles or epithelials. B. Melasma. C. Actinic or solar lentigines. D. Seborrheic keratosis. And E. Junctional nevus. According to our explanation, the correct answer is C, or actinic or solar lentigines. Explanation: actinic lentigines are benign hyperpigmented macules caused by chronic sun exposure. It's common in older adults on sun-exposed areas like face, hands, and forearms. It does not fade in winter, unlike freckles which usually fade in winter. It's uniformly colored, flat, sharply circumscribed macules. And differential points include freckles, which fade in winter and are smaller than 5 mm, and melasma, a large patchy pigmentation on the cheeks and forehead, and seborrheic keratosis, which is waxy stuck on papules or plaques, and junctional nevus, which are persistent uniform macules but typically few and stable. Okay, this was the explanation about Lentigo. Thank you for your attention.